Piles or hemorrhoids can present in many different ways. The commonest presentation is a patient who has bleeding from their back passage when they open their bowels. This is usually painless in the case of piles, and indeed if pain is an aspect of the symptom, it's usually due to something else, such as an anal fissure. Patients with piles also present sometimes with prolapse, where the hemorrhoids either permanently sit outside the back passage or come out when the patient opens their bowels, and on occasion have to be pushed back inside manually by the patient. It's a condition that people live with for quite some time, but it's also a condition which is eminently very treatable if the patient wishes to have their symptoms alleviated. The commonest causes of piles or hemorrhoids is actually unknown, and indeed I've spent a substantial part of my career with folk doing investigations into exactly why hemorrhoids arise and why patients get hemorrhoids. I think it's just a very common condition, and it's represented by cushions of tissue inside the back passage that contain both arteries and veins, and they get stretched and the cushions get pushed outwards, giving rise to different types of hemorrhoids. So some patients have purely internal hemorrhoids which might just bleed. Other patients have a mixture of internal and external hemorrhoids that are covered with skin that they can feel, they find them unsightly or uncomfortable. And some patients have just external hemorrhoids, or sort of skin tags or skin covered hemorrhoids, which again they don't like because they find them unsightly or they find them uncomfortable. Most patients are worried about the symptoms from their hemorrhoids representing something more sinister, because they rightly read in the internet and on social media that bleeding from the back passage or other symptoms can be an indication of an underlying sinister pathology. So many patients who come to see me, once I've proven that their symptoms are not due to anything untoward by the use of investigations such as a colonoscopy or a virtual colonoscopy to prove there's nothing sinister, most of them are happy to live with the symptoms of their hemorrhoids. Some patients are not, and those are patients that get treatments for their hemorrhoids. I think if you have hemorrhoids, the first thing you can do is try lifestyle measures. So increasing the amount of liquid that you drink and increasing the amount of fiber in your diet can help, because there's no question that softer stools are easier to pass than hard stools, and softer stools will help ameliorate the symptoms of hemorrhoids. The honest answer is no, I don't believe there is. I think if you're susceptible to developing piles, it's highly likely that you will. And indeed, I have patients who tell me that their piles or hemorrhoids run in the family. It's not like blue eyes and brown eyes in a genetic fashion, but there is a predisposition in some families for people to get troublesome piles or hemorrhoids.